Hello and welcome. I am Marianne Maldonado, CEO of the World Affairs Council of Greater Houston. And today we present another exciting conversation focusing on global issues. 2020 has been designated by the World Health Organization as the International Year of the Nurse and Midwife, in honor of the 200th anniversary of the birth of Florence Nightingale, considered around the world as the founder of modern nursing. And while many of us know the name, few can appreciate the practices she implemented long ago and how they will significantly impact modern healthcare. Today, we are joined by Beth Ulrich, nurse and professor at the Cizik School of Nursing at the University of Texas Health Science Center in Houston and editor-in-chief of the Nephrology Nursing Journal. Beth has written the book Leadership and Management According to Florence Nightingale, a collection of Nightingale's writings on management and leadership and how these practices have shaped healthcare today. Today, May 12th, marks the 200th birthday of Florence Nightingale, and I know we all have a special heartfelt appreciation and thanks for all of our medical professionals serving us throughout the world during this pandemic. Beth, thank you for joining us today.
You're welcome.
So tell me, what made you take an interest in Florence Nightingale?
You know, a lot of years ago, I had the privilege of going to a nurse executive program that was sponsored by Wharton School of Business and Johnson & Johnson. And part of what I did in our off time was wander through the bookstore at the Wharton School of Business, which is Mecca for any of us who've been in business for a while, right? And as I was walking the shelves, I saw Patton's Management Principles and Lincoln's Lessons on Leadership and all those books like that, but I didn't see any on leadership in healthcare. And so I thought there has to be someone in healthcare who has done this and who can help lead us by the wisdom or their experiences. And I found Florence Nightingale in a way I had never seen her before.
So she is revolutionary. I mean, she's an icon. We all recognize her name. She's famous for several things that come to mind. But tell us about Florence in her early years. What made her so revolutionary?
You know, she had a really interesting background. She was born to very affluent parents in England, although she was actually born in the city of Florence. And her role was supposed to be, she was supposed to grow up and be a lady and marry well and have a family and take her place in society. And that's not what she wanted. It turns out she had a sister, Partha, who wanted all those things. So the parents got a little of both. But she also had a father who was willing to teach her mathematics when she wanted to learn. In fact, a number of years ago, I got to go to the house she was raised in and stand in the library where her dad taught her and her sister, but much more Florence than her sister, I think, about mathematics and science and things like that. The other thing that influenced her early years is she witnessed the cholera epidemic or the pandemic in the 1830s. And it spread around the world, very similar to what's happening right now with us. She wanted to learn. She thought she wanted to be a nurse or to take care of people. And her parents actually approved her visiting some other countries and studying with the deaconesses in Kaiserwerth. And out of all of that, she returned with a calling that she wanted to help people. So in 1853, she gets a position to run the Gentlewomen's Hospital in London on Harley Street. Very small hospital in financial trouble. And it was her job to turn it around. And I think it turned out to be her management apprenticeship because she learned what to do and what not to do. She figured out ways to make things more efficient. She put in, as an example, a dumbwaiter that would take food and medicines and things like that from floor to floor. In fact, one of her famous quotes, she said, "Without things like this, nurses are nothing but a pair of legs, going up and down the stairs." So, and then the following year, the war had broken out between Britain, France, and Turkey fighting Russia in the Crimea. And that's when she started to think about going to the Crimea to help.
So famous for her leadership of a small team of nurses, staffing an overseas hospital during the Crimean War. Can you explain what made her work there so significant?
Well, picture this. When Florence went to the Crimea, she recruited 40 nurses, which seemed like a lot until she got there and realized how many patients it was. So 40 nurses go on a boat, no airplanes then, right? They go on a boat to the Crimea. They get to the Crimea, and what do they see in front of them at their first hospital at Scutari but a barracks hospital building? Now imagine this. It was a quarter mile on each side, 4 stories, 4 miles of beds, thousands of patients. Very scarce medical supplies, although she had been promised sufficient supplies. Not many linens, not much food, vermin, pests, and stacks of body parts from amputations that they had done to the soldiers in the battles. And so Florence looked around and she said, oh, and by the way, the doctors didn't want her there. They didn't think they needed any nurses. They thought they could handle it all themselves. So Florence's approach was to tell her nurses, she said, I want you to get rid of the dirt, get rid of the filth, get rid of the pests, get rid of the vermin, get rid of the piles of amputated body parts. And you also have to understand that this hospital was built over a sewer system. So nothing is good here about infection control or getting well or any of those things. She told the nurses, however, don't touch the patients until the doctors invite us to touch the patients. As it happens, that didn't take long because on the very next day was something called the Battle of Inkerman. And the British had 2,500 casualties who presented themselves at the hospitals in the Crimea. And suddenly the doctors thought perhaps they needed the nurses. And they invited the nurses in. But the bad stuff wasn't over. So to make matters worse, the supply ship gets caught in a hurricane the next week, and all of her supplies go down in the middle of the ocean. So she learned really quickly how to do stuff with just put it together and do with what you had. They had 3,000 deaths in 2 weeks. But one of the things that she really discovered was that taking care of a patient was beyond taking care of the patient. That you had to take care of the family because a lot of the families had followed the patients. And you had to not just do the physical care for the patient, they needed mental care too, right? When they're in this hospital, they don't know when they're getting well or if. And so she started things like a cafe for the soldiers as they got better. And she put a library in and all those things that now we think about. Of course, we do care for the family and we take care of folks. But that was revolutionary at the time. So the story that I've always held in my heart, especially as I've been an executive, is Florence was actually in charge of 4 hospitals in the Crimea. And so she made a trip over to a hospital in Balaclava to inspect the hospital. And while she was there, she got the Crimean fever or some level of it. And she was sick for a while. And when she got ready to go back, a couple of the physicians who were not happy about this woman who was getting written about in poems by Longfellow and was being heralded as a hero, they didn't really like that. And so they came up with a scheme that they were going to put her on a different ship without telling her, a ship that was going back to England. And that by the time she got back to England, they figured it would take her months to get back to the Crimea and they wouldn't have to deal with her for months, except she had friends and they found out the plan. And so I've always said, as long as my bosses haven't been ready to put me on a ship back to another country, maybe I was doing okay, right? But she came home with a mission of reform, not just of illness care, but of all aspects of healthcare. So that was her first real adventure, and the one most people know about.
Mm-hmm. So she really kind of changed the whole face of nursing, taking an untrained profession, making highly skilled, well-respected healthcare professionals with hugely vast and important responsibilities far beyond the patient. Tell us about her work after Crimea.
Well, after Crimea, thanks largely to Longfellow's poem that he wrote about her carrying the lamp and spreading the news about her, the country had raised a lot of money for her. And she wanted to build a formal professional school of nursing, which she did at St. Thomas Hospital. She thought nurses should learn from experiences, not just from books. And that holds true today when we use simulation and things like that. We think experiential learning is very important with nurses and also with other healthcare professionals. She encouraged the students not to settle for being the best woman at something, because at the time they were all women, but she said you should be the best person. Be the best nurse, not the best female nurse. Be the best boss, not the best female boss. And that was way ahead of its time. She talked about networking. She implemented 360-degree evaluations, which I don't know about you, but I didn't implement till well into my career or learn about. She wrote notes on nursing, and she meant it to be not just for nurses, but for people who took care of other people. And she talked about 5 elements on Notes on Nursing: healthy environment, pure air, pure water, efficient drainage, cleanliness, light. Those are the things we talk about today as being very necessary. But this was, 150 years ago. And she practiced leadership and learned it better. She has this great quote that I like. She says, "Let whoever is in charge keep this simple question in her head. Not how can I always do this right thing myself, but how can I provide for this right thing to always be done?" And as I've taught new managers and new executives over the years, people want to do it themselves. And it takes a lot of confidence to teach other people to do it. And Florence was preaching that way back then. She also initiated efforts to improve the health system in the British Army because she had seen the worst of it in Crimea. And she convinced Queen Victoria to set up a whole commission to reform the British healthcare system for the Army. So, just a number of, there was nothing she wouldn't take on, I think.
I'd love to meet her.
Yeah, I would too. I have one 10-second video of her voice from when she was alive. And that's the only thing we have recorded of her.
She truly was an innovative thinker, thinking, well beyond the medical standards of the day. So tell us about how she gathered her thoughts around gathering data, such as health statistics. That's something we rely on so much now on, and yet she was, like you said, 150 years before her time, basically.
Absolutely. She was one of the first people to both understand and articulate that healthcare outcomes should be measured and they ought to be reported in a very systematic way. In 1860, 150 years ago, she developed a uniform hospital statistical system because she thought all hospitals should report the same data. And she got told it was too complicated. And if she saw what we had today, I can't imagine what her response would be. But she also said that these statistics would let the hospitals and the country understand the resources that were required to care for patients with all different kinds of diseases, and would show which hospitals achieve the best and worst outcomes, not unlike we're doing today, how many years later. She also pioneered the use of graphs for statistical representation. And I don't know about you, but I see a lot more sometimes when I see a graph than when I see a lot of words on a page. So she did that. Her famous quote on statistics was, she said, "These statistics would show subscribers how their money was being spent, what amount of good was really being done with it, or whether the money was doing mischief rather than good." So even then, she was looking at how people were spending their money. She also looked at mortality. We used to talk about patient dumping when hospitals would try to not take patients they were going to lose money on, as an example. And Florence understood that the hospitals, and at that time, were discharging patients to home so the patient's death would show at home and not in the hospital. So she started collecting data on mortality of hospitals. It was real data. And then she also, they wanted to make a new hospital in London. And they asked her to look at where it would be best situated. And they were thinking downtown London. And Florence did what would be the equivalent of a zip code analysis today to figure out where the patients came from. And then she told them that's where you need to put the hospital, not way far away from where the patients are. So things like that I think most people have no idea that Florence Nightingale worked on.
Wow. And in addition to vastly improving kind of so many of the procedures, and she also understood the importance of hospital design and how keeping the sick separated from the healthy in the hospital. Can you tell us a little bit about that?
She wrote this book called Notes on Hospitals after she wrote Notes on Nursing. She actually wrote like 200 books and articles and reports and things like that. So she was a prolific writer. And one of her statements in Notes on Hospitals, which I think is very telling and we should use today, she said, "It may seem a strange principle to enunciate as the very first requirement of a hospital that it should do the sick no harm. It's quite necessary, nevertheless, to lay down such a principle." So the first thing she talked about was doing no harm. And then she had lots of leaders, and Florence was unique in that she would have leaders come to her, whether they were princes or I think she went to visit Queen Victoria, but that's about the only person she left her house to visit. It was largely people coming to her who wanted to know about hospital design, and they also wanted to know about education for nurses. One of the examples of Florence talking about hospital design, besides the pair of legs analogy out of the Harley Street Hospital, is that she said that women who were having babies were not sick, and they shouldn't be housed with sick people. And so she encouraged, and they started a number of what were called then lying-in hospitals, which was where a woman went to have her baby and not be exposed to any of the kinds of things that are in hospitals innately just because they're hospitals with sick people. So that's one example of how she looked at hospital design.
So she was frequently called upon to manage or to maybe oversee or to administer in field hospitals. What were some of her contributions there?
Well, when the American Civil War broke out, the doctors and a lot of other folks called on her, wrote her for advice on how to care for sick and wounded troops, because she had seen it all in the Crimea and she had helped develop some really effective systems. When she left the Crimea, the infection rate in the patients had dropped drastically from what it was when she got there. So she had all those experiences and that knowledge, and she gave that knowledge to us in America when the Civil War was going on.
Hmm. So bringing her contributions full circle, she also served as an authority on public sanitation issues in India for both the military and civilians. Things such as how simple hand washing can stop an infection. Tell us about that.
Well, of course, India was part of the United Kingdom, and so she had concerns there and some that she had learned about while she had been overseas. And so that was next on her list after the British Army, fixing the healthcare in the British Army. And Queen Victoria asked her to look at India because they were having some major problems. She did. She helped. She collected the data. She interviewed people. She analyzed the results. But when she was done, the commission's report was over 2,000 pages. So another lesson for us to use today. She understood that no one was going to read 2,000 pages, right? And so she wrote a 23-page executive summary, which is longer than we write today, but compared to 2,000 pages was pretty good. And then she had her sister illustrate the executive summary. And she thought in that way people would read it and be interested. She also then sent advance copies to influential people and to journalists so that she was sure the information from the commission would be disseminated. So a little strategy there.
She was a smart woman.
Yeah, she was.
And from what I learned about Florence, she not only had an impact in healthcare, but also history, politics, management, philosophy, leadership, innovation, maybe a little coercion. I don't know.
I'm pretty sure.
What were some of her? Tell us some of her contributions in some of those areas.
Well, Florence had a really good knack of reading people and knowing who was in power and whose ambitions could be used to align their power with hers. And she was a pretty big force and very persistent. She was also very good at defining problems and formulating solutions and was a good role model in that. And she believed in what she did. So one time someone asked her to define why she was successful in these kind of disaster and crisis situations. And I love her quote. She said, "I attribute my success to this. I never gave or took an excuse. Yes, I do see the difference now between me and other men. When the disaster happens, I act and they make excuses." So that was Florence's quick summary on why she was successful in those things.
I really look forward to meeting her one day. So what do you think Florence Nightingale would think of nurses and of nursing today, especially during this worldwide COVID-19 pandemic?
I think if Florence was here today, first of all, she'd be very proud to see the work nurses are doing, especially with the patients with COVID-19. And she'd be contacting whoever could help make sure that the nurses have what they need to do their job. And it wouldn't matter who that was. One of Florence's skills was that at the time she was around, women didn't speak up. Women weren't in parliament. Women weren't, short of Queen Victoria, women weren't in powerful positions. So Florence would write letters to people that she knew could help her. And she would often write two letters. She would write a public letter and she would write a private letter. And the public letter was one the person could share with the public. And very often she would tell that person how to share it and who to share it with. And the private letter would say, you should ask this person this question, and you should convince this person to do this thing. So she was a big communicator. And I could just see her today, who she'd be writing in the White House and the Senate and in the House of Representatives and everywhere else she could get in to make sure nurses had what they needed to do their job and to make sure our patients were getting taken care of. She'd also be happy that we're seeing the work of nurses. I think very often people hear the word nurse, but they don't imagine what nurses do, or they imagine the nurse at the doctor's office or the school nurse that their child is taken care of by. But Florence was really clear about what it took to be a nurse. And I think today we've seen a lot of that as we've seen pictures of COVID wards and nurses in all manner of protective equipment and protective equipment that should be better, right? But they make do. And that's one of the things about nurses, give us a problem and we'll figure out a way to work around whatever we don't have. But one of the things Florence said about people not understanding nurses, she said, or healthcare, she said, if there's any nonsense in people's ideas of what hospital nursing is, one day of real duty will root it out. There are things to be done and seen which at once separate the true metal from the tinkling brass, both among men and women. And the other thing I'm really sure of is she had been gathering statistics from the first day of this pandemic. And she would be using those to learn how to provide better patient care and tell us how we could do it better in the future.
Beth, you've had a long career as a nurse, educating nurses. In your professional career, what would you say is her greatest, should be her greatest worldwide legacy?
She's got so many, Marianne. Over the course of her career, she was a nurse, she was an author, she was an innovator, she was a statistician, she was a visionary, she was an administrator, an architect, she communicated, she was a reformer, she was a leader, all those kinds of things. And I think that's part of her legacy, is that nothing is too big or too small when there's a problem in front of you. She she started off with her Notes on Nursing book is basic instructions on how to give nursing care in the home or anywhere. Then there's all the political intrigue to improve the healthcare of nations that she did. And out of that, she's left us a wonderful legacy for nurses and the nursing profession. And as I hope all of your listeners today have realized, many of her words and her experiences are just as relevant and inspirational today as they were over 100 years ago.
You have a fascinating book on Florence Nightingale, and I know that you're working on something new. Can you tell us about that?
Well, I am. The first book I did was on management and leadership, and I really concentrated on things that would help managers and leaders improve their practice where they learned from Florence. And now I'm going back and looking at all of her quotes and all of her anecdotes, and we're going to do a book of quotes and anecdotes and probably turn it into a journal for nurses too. So I think that'll be exciting, and it'll help teach the next generation of nurses about one of their great ancestors in nursing.
That's great. Beth, thank you for joining us. For those who have just tuned in for the first time, make sure you check out all the World Affairs Council videos. We have our own YouTube channel. Click on the little bell to subscribe to our channel. Until next time, thank you so much and have a great day.
Thanks, Marianne.